If we are talking about capacity building, so we know that it is an integral part. And if we're talking about health sector, so yes, it is very necessary for all of us. It not only enhance the efficiency but efficacy of healthcare providers and health system also.
The care that nurses and midwives give has a profound impact on people's lives, making up more than 50% of the healthcare workforce. They have tremendous influence on the lives of numerous people. This show is exclusively for nurses and midwives, where we engage in the conversation to explore the dimensions of nursing and midwifery.
Can you please introduce yourself and tell us about your nursing journey, Sachin?
Yeah, thank you, Raj. Myself, Sachin Dwivedi, and I belong from the land of white tiger. The city name is Riva, and Riva is famous for the white tigers. The first white tiger was Mohan. Riva city is also named after the ancient name of River Narmada. So I basically belong from a middle class family, and my father is a farmer. I was an average student during school time. About my nursing journey, one incident was happened when I was in class 11. One of my uncle had a heart attack and was admitted in an ICU of government tertiary care hospital there in Riva. So that time I visited there and I sat with him and asked about his condition. So he told, these are the lifesavers, the healthcare professionals in white uniform. He pointed out the nurses, those who are working there. All the care is rendered by them. So that day something happened in my mind and I decided to pursue a career in nursing. So basically I completed my BSc nursing from Sodamini Institute of Nursing and Research, Riva, in 2013. Then I went for my Master of Science in Nursing to Pragyan College of Nursing, Bhopal, and completed in 2017. In the year of 2019, I have completed a certificate course in palliative care along with one certificate course in biomedical research. And recently, in the year of 2022, I have done my fellowship in palliative care from Institute of Palliative Medicine, and this course is jointly organized by St. Christopher's, London.
Quite interesting to hear about your journey and the White Tiger city you belongs to. And you mentioned about the palliative care as well. You have extensive experience in palliative care. Could you share some insights into your work in this field?
Yeah, actually, I have done my master's in medical surgical nursing, and my subspecialty was cardiovascular and thoracic nursing. But when I joined King George's Medical University, after completion of 6 months in critical care ICU in Vedanta, the Medicity, one incident happened. One of the senior employee from our office, he looked sad and disappointed. So I asked him, "Sir, what happened? Is there anything happened or everything is okay?" So he replied with a false smile, "Yes, everything is okay." Then he had busy with some work. The next day, when he again encountered me, I asked, "Sir, I noticed that you are in sad mode. Please tell me." Then he told, "My wife is suffering from illness for past 2 years, and the doctors are not able to find out what she actually has. She was fed up with the investigation and now she refused for further investigation." Then I asked him, "Have you taken a second opinion? Because all we know it's patients and family right." So he told no. Then I suggested him for a second opinion. And after a week, he has taken a second opinion. And I think after a month of consultation and the biopsy reports, the doctor diagnosed her with extrazonal marginal node lymphoma. He told me about the diagnosis. So I always try to listen him patiently after knowing the diagnosis of her and try to console him and give some hope. She has undergone chemotherapy for 2 years, and in the initial phase, she denied to eat anything and I think lose hope. Then again, he told me. So I decided to visit her home and listen to her carefully. I tried to explain the importance of food and her actual condition. I remembering that almost 7 to 10 days after my visiting there, she started taking food willingly and also praying to God to overcome from this situation. After that, I have visited many times, but she improved well and she did well. After one more year of chemo, her PET CT shows a normal report. So it was miracle. Now she is living a normal, healthier life. So this incident totally changed my mind, and I entered in palliative care. Then in 2019, I have completed a certificate course in Essentials in Palliative Care from Indian Association of Palliative Care. So this program is jointly organized by King George's Medical University and IAPC. After that, I have involved in taking sessions in palliative care workshop for paramedical and nursing students in KGMU Lucknow. I have also involved with some of the pioneer institute like Pallium India, Institute of Palliative Medicine, Department of Family Medicine Philippines for taking the guest lecture on topics related to palliative care. In the mid of 2021, I left the KGMU and joined my hometown in Shamsa Medical College, Riva as a nursing officer. In the mid of 2021, I left the KGMU and joined Shamsa Medical College, Riva as a nursing officer. And in the early month of January, we have founded the Rise and Heart Foundation.
As the founder and CEO of Ryzen Heart Foundation, what inspired you to establish this organization? And can you tell us about the mission and work of the foundation so that people can be inspired by this?
Yeah. So after leaving KGMU, I joined Shamsha Medical College, Riva, as a nursing officer. That time I realized that we need some support from organizations and NGOs for organizing training and some sensitization program for healthcare professionals. And I also tried to contact some of the organizations and NGOs, but I failed to connect with them. And then one of my CA friends suggested that why you are not going to establish one non-profit organization. So I discussed with my wife Jaya, and we founded Rise and Heart Foundation in the year of January 2022 with mission to work on healthcare education and training and social support activities. So in early months, we have organized health camps, health checkup camps with the help of some physicians. And we also organize blood donation awareness activities. We have celebrated kidney days, cancer awareness programs in different colleges in Riva. And also the during the blood donation awareness activity, actually myself donated blood almost 14 times. And I have decided to donate the blood twice in a year, once in my birthday and once whenever I completed the next 4 months. So the blood donation awareness is also very important aspect of this organization mission. So now we are trying to collaborate with the nearest healthcare setup to start some home-based palliative care for needy people. So our mission to establish this organization is to serve the people, those who need it.
Also, you have been involved in various capacity building programs for healthcare professionals. What do you think about the current status of capacity building in India? Since we see like the government, leaders, everybody is engaged with this particular issue of capacity building. I mean, what do you think about it?
Yeah, if we are talking about capacity building, so we know that it is an integral part. And if we're talking about health sector, so yes, it is very necessary for all of us. It not only enhance the efficiency but efficacy of healthcare providers and health system also. So I think 2 to 3 months ago, Union Minister Mansukh Mandaviya sir have launched one annual capacity building plan for the capacity building of civil servants of health ministry. So there are so many organizations like NIHFW, Ministry of Health. They are working with the state government to provide training and workshops for the healthcare professionals. But if we are talking about nursing point of view, I personally feel that every healthcare institutions needs a training department or training cells, just like a recruitment cell. And the training should be mandatory for all healthcare professionals periodically. I also feel that the credit system in training could make a positive impact. It's not only encouraged healthcare professionals, but is also updated the recent advancements and protocols and policies. I have gone through with the Maharashtra Nursing Council. They have mandated that before the renewal of registration certificate, the nurses need to achieve some of 25 CNE credits 5 credits every year. So I think they have taken a great initiative. So through these credits, nurses are updated and about the recent advancement and all. So I think all the state nursing councils as well as institute can take the initiative to organize periodic training program, also in collaboration with the other organizations and other departments. So it is very necessary in our field.
Can you tell us about your role as a nursing officer at the Ministry of Ayush Regional Ayurveda Research Institute, and what are your main responsibilities and projects?
Yeah, I'm working in this role for more than 1 year, and my responsibilities here are mainly for patient care advocacy. So here, people mainly came for research involved in research activities. So during the consent process for research, they need some clarification. So I always will be there to help them and to understand about what is the actual protocol, and if they want to refuse, if they want to not to participate, so what is the procedure. Not only this, but I also involved in planning implementation of health education to the public as a part of outreach program. Along with this, I also involved in capacity building program for the healthcare workers of the institute on various areas like infection control, basic life support, biomedical waste management, and pre and post exposure prophylaxis. I'm also serving as an infection control nurse trainer. This is mainly to encourage the health professionals of the institute to adhere the infection control practices. And I also an active member of NABH committee of the institute for quality control initiative. So these are my role and responsibility in the institute.
Really inspiring to hear about your patient advocacy areas of expertise, and we need nurses like you who are eagerly doing the job for the patient advocacy. Your involvement in the Global Nursing Fellowship by St. Christopher's Hospice London is impressive. Can you share some experiences from this fellowship and how it has influenced your approach to nursing and patient care?
Yeah, I joined this fellowship in palliative care in January 2022 with the aim to develop skills to manage and support the patient with palliative care needs. So we in fellowship batch 2022, fellows from 55 different countries have been involved and mentored by stalwarts in palliative care. So before this fellowship, my thought about palliative care is that it is only limited to the cancer patient. But after entering the course, I realized that palliative care is not limited to cancer patients, but also other life limiting conditions such as stroke, chronic kidney diseases, dementia, heart failure, and spinal cord diseases, etc. We have now a global network to support on teaching and training activities, as well as India network to coordinate and integrate palliative care access and capacity building through the network groups like Institute of Palliative Medicines, Pallium India, Indian Association of Palliative Care, Palliative Peace. So these are the institutes, they continuously working on capacity building as well as community-based palliative care, home-based palliative care, and to increase the palliative care access throughout the country.
Thank you. And also, you have been part of multicentric research projects involving multiple Asian countries. What were the key objectives of these projects, and what were some of the significant findings or outcomes?
Yeah, I think recently in the month of March 2023, we, the Fellowship of International Fellowship Group of 5 different countries, including Myanmar, Brunei, Thailand, Bangladesh, and of course India, we had one focus group discussion on situation analysis of palliative care service and how it is impacted during COVID-19. So now palliative care provides active holistic care for the people with serious health relating suffering due to illness, especially near the end of life. So we found that in the Asia Pacific region, there is a variability in palliative care services and access to drugs with predominant focus on hospital and cancer. The COVID-19 pandemic also disrupted the development of provision of palliative services. So in this situation analysis, we have concluded that the The overall palliative care is an underserved specialty despite an obvious need for the services in each locality. So while the pandemic significantly interrupted palliative services, palliative care providers adopted by developing guidelines and using telehealth or teleconferencing. So overall, much work still needed to be done to improve the palliative care in the region. So now we are in planning phase to initiate the another multi-centric project, mainly focus on the death literacy.
You have been involved with training and mentorship as a clinical instructor. What strategies have you employed to effectively mentor and train nursing students? And how do you prepare them for real world challenges in healthcare setting?
Yeah, personally, some of the strategies I employed during teaching my students, uh, like team-based learning. So, team-based learning mainly maximizes students' participation in the learning activities. It also develops active learning and raises teamwork performance, which can enhance the students' engagement in both academics and clinical setting. Then, collaborating testing like applied quizzing. So quizzing has become most popular method for assessing learning and retention of knowledge as well. So in this, students work together in small groups to complete the quizzes before they select their final answer. So the main advantage I found that they have peer-to-peer interactions. They share their views and education, and there is a collaboration during discussion of each question. But the another strategies I have employed that peer assessment. So this peer assessment we also employed during our masters also. So it is a process when the students evaluate the learning or task performance of their peers. So we many times we did during our masters to evaluate the our batchmates. So this is very effective method, and yes, simulation based very commonly we have seen nowadays. So we know that the simulation is an essence that allow for the investigation of human elements and their interaction with their surrounding. So simulation allows students to become more confident in dealing with the high pressure, learning from their mistakes in a safe, supportive environment, and also gain some experience with conditions they may not encounter during clinical. About the facing the real world challenges, the student should have some good skills like effective communication skills. They have strong clinical skills. They think critically before acting. They also need to be emotionally competent to deal with the stress. Always think about evidence based practice and try to practice it. And I also advocate for the nurse led interventions that will help to increase the evidence based nursing practices, and also emphasis on the soft skill as well as periodic updation of knowledge and skills.
Quite interesting to know that you are emphasizing the simulation based training. Uh, what were your experience in this area, since this is growing field in India, and even Indian Nursing Council also started on a pilot basis to provide simulation training to the faculties in institutions. So what are your thoughts on this?
Yeah, I personally feel that most of the corporate hospitals they are providing this simulation during the I think initial phase when any staff entering to the institutions, so as a part of induction program. But I also encountered this simulation based training during my uh, work in King George's Medical University. So we have some mannequins, that simulation based mannequins, and it is a great start because government is promoting to provide the highly sophisticated simulation mannequins to provide the environment for the nursing students. So some of the institutions they have a nodal center to provide this simulation based training, and TNAI also taken one initiative. I think in the Noida they have the skill center known as Daksh centers. This is mainly focused on the maternity and child related training. So these type of training really very great impact on the learning of nursing students, as well as the trained nurses, those who are already completed. And if there is need to any uh, need to provide any environment and control environment to how they will manage the situations during care of the patient. So that simulation is really a great technique. And recently, I have visited the NIHFW, National Institute of Health and Family Welfare, and they also have the Center for Skill Development. So they also have the same mannequins that provide the maternal and child, especially for the management of PPH and all.
Your research publications cover a wide range of topics. Can you highlight one or two research papers that you consider particularly significant or impactful? And if you can explain their relevance to healthcare communities?
Yeah, during the early phase of lockdown, Mr. Mahinder Kumar from PGI Chandigarh and I did a project on the impact of COVID-19 imposed lockdown on the Indian population and their habits. So we have sent one Google form to the people. I think more than 7 to 800 people uh, involved. 749 that I remembering that people have participated in that survey. So we have got a result that lockdown impacts on daily routine and habits of the people, especially the sleep pattern, eating habits, and internet use. So we have concluded that yes, lockdown situation has changed the habits and way of living pattern. As the sleep pattern, earlier people were used to get up 8 a.m. before only 12% people wake up before the 8 a.m. But after the lockdown, the data reached to 42%. And 23% participants used to mobile phones at several times a day before the lockdown to talk to their friends, family. But since the lockdown, the percentage of participants increased up to 44%. And some of the study result also shows that the lockdown, during the lockdown, people are spending more time in activities like watching TV, music, almost 43% participants. Earlier, it was only 21%. So, this article or project mainly helped to understand the need of people and their habits during the early phase of lockdown. And this will help to understand the habits and people activities during how they are managing during the lockdown. And this was very small project, and I think in a year it processed more than 100 citations. Then another article I have written on ghost writing. So this is something new I have found, and actually I have encountered this thing personally. So in clinical research, presenting findings in a meaningful way is equally important. So sometimes researchers take help from other people, those who are not involved in a particular research group or study. So a very common example, the seniors send the framework or manuscript, just frame out manuscript to the juniors. So they write all these things to their seniors like that. But what I personally feel that this ghostwriting is not ethically right. So ghostwriter neither are visible to editors or peer reviewers or readers or those who may wish to hire the author or the writer. They are also publicly not accountable for their work because they didn't get any credit. So the reasons authors prefer ghostwriting are maybe what I understand is lack of time. Maybe they have poor writing skills or less confident to get published in highly indexed journals, and lack of information about how to prepare the manuscript for the some reputed journals, because sometimes there are some pressure to publish in a good reputed and highly indexed journal. So I have found that how we can overcome this type of ghostwriting practice. So I think we need to adhere to the guidelines for research reporting and writing. And there should be a proper authorship criterion. There should be a clear acknowledgement section that gives credit to all who contributed substantially. The author can also declare the contributorship if they have included any professional writers in assisting the paper or preparing the draft of manuscript. So these things should be keep in mind. So accordingly, we can uh, prevent these ghostwriting practices, and we can give the proper acknowledgement to them.
You have published research paper on very trending topics of organ donation in India and nurses as a change to lead in organ donation. How you imagine the lead role of nurses in this area?
Yeah, the organ shortage is an ethical, social, moral, and I think also a political problem causing unjustifiable damage to society. The deficiency of organ acquisition from the cadaveric donor is a globally a matter of concern, especially in developing countries. And unfortunately, India with 1.4 billion population is lagging behind in organ donation with a national disease donation rate of less than 1 per million population. Some of the important reasons to understand why nurses can act as an ambassador to increase organ donation and can spread the awareness are the area of nursing practices is filled with empathy, compassion, esteemed for majesty and value. The nurses are core concern and commitment are always towards their clients and patients. The nurses always advocate for their patients when they can't speak for themselves. The nurses can help families and caregivers to provide information with all facts and legal procedures regarding the organ donations and pledging process. Nurses not only help the family and patient, but also educate about what are the common myths due to any cultural and social reason involved. So the patient and family also found nurses are more accessible as compared to the other health team members like physicians. And nurses are closely involved during end of life care also. So this can be greatly affected request for organ donation. And I have also found some of the studies, and they suggested that a donor family is accepted transplant coordinator and found it easier to discuss and express their thoughts compared to doctors. So, countries such as Spain, Australia, and the United Kingdom are a step ahead and have introduced nurses as a transplant coordinator. So, I'm not so much of sure, but in public sector of India, there is no permanent position for transplant coordinator. But I have encountered that in many of the corporate hospitals, they recruited and trained the nurses to become a transplant coordinator.
As a mentor for the fellowship in palliative care, what advice do you have for aspiring professional in this field? And what skills and qualities do you believe are essentials for individuals pursuing a career in palliative care? And anything else you would like to add for the nurses, for the students, or anyone?
Yeah, palliative care is an interdisciplinary approach. So, main aim of this palliative care is to improving the quality of life of both terminally ill patients and their caregivers. And India has a large burden of suffering from terminally ill and life-limiting illness patients. So, palliative care is mainly restricted to major cities and cancer centers, except for the Kerala. Their services are more readily available than in other states. So we can say that we need to implement the Kerala model to establish the palliative care services or to start the palliative care services all over India. So there is a felt need for palliative care education and training in India. So I just want to say to the nurse aspirant, they can pursue their career in palliative care. I feel that still in the public sector, there is a limited opportunity to get basic to specialized training and job opportunity in the field of palliative care. But now, so many reputed institutions, they have sent the draft to INC also to start the master's course in palliative care. And very soon, there may be some changes, and some of the institutions also give the permission to start the DNB in palliative medicine. So we are trying to increase the healthcare professionals in the field of palliative care. Some of renowned institutions like the Institute of Palliative Medicine's Kozhikode and St. Christopher Hospice, London, Sanjeevan, Pondicherry, they collaboratively provide some foundation course in palliative care, and also they are providing fellowship in palliative care for the nurses and other healthcare professionals. And Pallium India is also providing extensive opportunity for the nurses and healthcare professionals to get trained in the area of palliative care. They also provide home-based palliative care and to tackle the need of the palliative care patient. And the Indian Association of Palliative Care also collaborate with the medical colleges and teaching institutions pan-India to provide certificate courses for the healthcare professionals, including the nurses. I was the part of this training program through the IAPC. Then some other organizations such as LNEC, Denip Care, Can Support, they are also actively involved in teaching training practices in the field of palliative care. About the skills and qualities essential to pursuing a career in palliative care. So I think the those who want to pursue a career in palliative care should have compassion, commitment, empathetic communication, active listening, advocacy, critical thinking and decision making, and yes, leadership skills. So these are the some qualities that the person, if have, can do much better in the field of palliative. I always try to convince and try to encourage the nurses to be a part of research project, to initiate the research project. I always try to encourage my students also, those who have recently joined some of the good renowned institutions like AIMS or PGI. I always encourage them to ask about the research unit there, to contact there and to collaborate with some of the research projects and to initiate some nurse-led projects in the area of nursing. That may be something that we can do from the nursing point of view, because all these things should be nowadays evidence-based. So why we are not practicing evidence-based nursing? So my message is to all the nursing participants or nurses or aspiring nurses to come forward and involved in the research process, do the research and show your competency and uh, uplift the other nurses also. Initially, we are focusing about the physical health and psychological health, and somehow we are not able to complete the all the aspects of the care. But now, especially in the palliative care, and not only the palliative care, we are think the whole through the holistic approach. So we are not only caring the people through physically, but yes, psychologically, socially, spiritually, emotionally. All the aspect of care included in this holistic care of approach. अगर हम बात करें कि evidence based practice, like during COVID-19 we are facing so much of issue because we didn't have some of evidence which medicines and which therapy is the beneficial for the COVID-19. तो वहां पे हमारे पास evidences नहीं थे उतने, so हम बहुत ज्यादा struggle कर रहे थे. This is entirely different from the holistic approach. So in evidence based practice, whatever researches, whatever the clinical trials have already being done, on the basis of that we are practicing the things in our clinical area. My message to the nurses also to do some evidence based nursing practice. So the nurses can be a change agent, nurses can be a researcher to develop some evidences, to develop some protocol and come forward and apply it to the practice to improve the nursing care or patient care.